Hello and welcome to our video. Today we'll discuss the 8 warning signs and symptoms that may indicate the presence of potentially dangerous blood clots in your body. While the body naturally forms and dissolves blood clots throughout the day, there's a risk when they fail to dissolve properly, becoming lodged in an artery or vein. This obstruction can impede the flow of blood to and from your heart, potentially resulting in severe issues like heart attack, stroke, or embolism if not addressed. If you experience any of the signs and symptoms discussed in this video, it is crucial to seek immediate medical advice. Don't hesitate. Prompt attention can make a significant difference in preventing life-threatening complications. Just a quick reminder, this video is for educational purposes only. Always seek the advice of your doctor if you have any medical concerns. By far, the most common blood clots that you're likely to have are a blood clot in an extremity, either the leg or the arm, which is medically known as deep venous thrombosis or DVT, or a blood clot that has traveled from a deep vein to a lung known as pulmonary embolism or PE. Let's first discuss the signs and symptoms of blood clot in the legs or arm. Number 1, swelling in the leg or arm. Swelling in the leg is a significant and often noticeable sign of DVT. When a blood clot forms in a deep vein, it obstructs normal blood flow. This blockage prevents blood from circulating properly, leading to increased pressure within the vein. As a result, fluid from the bloodstream can leak into the surrounding tissues, causing swelling. In the case of DVT, this swelling typically occurs in one leg, commonly in the calf. In more severe cases, it can extend to the thigh and even the entire leg. This is a crucial distinction, as swelling of both legs is more likely to be related to other causes, such as heart or kidney issues. So, if you observe swelling in just one leg, it should raise suspicion for DVT. It's important to note that while DVT in the legs is a common scenario, blood clots can also form in the arms. Number 2, pain and tenderness in the leg or arm. Commonly, individuals experience pain in the calf region, although it can also affect the thigh or even the entire leg. The pain is often described as a cramping or sore sensation. Unlike muscle strains or injuries, DVT-related pain often worsens with movement, especially when walking or standing. This is because movement increases blood flow, which can exacerbate the clot and intensify the discomfort. Individuals may notice that the pain is more pronounced during activities that engage the leg muscles. The pain tends to be persistent and may not be alleviated by rest or over-the-counter pain medications. The area around the blood clot may become tender to touch. If you gently press on the affected leg, you might feel increased sensitivity or pain. This tenderness is a result of the inflammatory response triggered by the clot, and it can serve as an additional indicator of DVT. Number 3, red or discolored skin. Blood clot disrupts normal blood flow, leading to an inflammatory response. This causes the skin to appear red or even have a bluish tint. The intensity of redness can vary. While the entire leg may not necessarily be uniformly red, localized areas of discoloration may be observed. This can be especially prominent around the site of the blood clot. The skin over the affected area may feel warmer than the surrounding tissue. The warmth is a result of increased blood flow and the inflammatory response triggered by the clot. This combination of warmth and redness is a clear indication that something is affecting the normal vascular dynamics in that specific region. Now, let's discuss the signs and symptoms of blood clot in the lungs. Number 4, sudden shortness of breath. Perhaps the most characteristic symptom of a pulmonary embolism is a sudden onset of shortness of breath. This symptom is a result of the clot obstructing blood flow in the pulmonary arteries, leading to a rapid decrease in the oxygen supply to the lungs. Individuals may find themselves struggling to catch their breath without any apparent trigger or exertion. It is often described as a feeling of intense breathlessness or an inability to take in an adequate amount of air. This sensation can be particularly distressing and should not be dismissed as a normal occurrence. Number 5, chest pain. Chest pain is another prominent symptom of pulmonary embolism. The pain may be sharp, stabbing, or feel like a constant ache. It is often worsened by deep breaths, coughing, or movement. The location of the pain can vary, but it is commonly felt in the chest and may radiate to the back or arms. The sharpness of the pain is often a result of the blood clot causing irritation and inflammation in the pulmonary arteries. Number 6. Rapid heart rate. Rapid heart rate, also known as tachycardia, is a significant and common symptom associated with pulmonary embolism. Tachycardia refers to an abnormally fast heart rate, generally defined as a resting heart rate above 100 beats per minute. Tachycardia associated with pulmonary embolism often has an abrupt onset. Individuals may notice a sudden and rapid increase in their heart rate, even at rest. This abrupt change is a physiological response to the body's attempt to compensate for the decreased oxygenation of the blood. Number 7. Unexplained cough. Individuals may experience a sudden onset of a persistent cough or notice a significant change in their usual cough pattern. This change may occur without any apparent trigger, such as exposure to irritants or respiratory infections. In severe cases, the cough may be associated with the expulsion of blood, a condition known as hemoptysis. This occurs when the blood clot in the pulmonary arteries causes irritation or damage to the blood vessels in the lungs. The blood expelled during coughing may vary in color, ranging from bright red to darker shades. The amount of blood can also vary, from small streaks to more significant quantities. While not everyone with PE experiences hemoptysis, its presence can raise the suspicion of a more severe clot burden. Number 8. Very low blood pressure, lightheadedness. Pulmonary embolism can result in a sudden drop in blood pressure, a condition known as hypotension. This occurs when the blood clot obstructs the pulmonary arteries, compromising the heart's ability to pump blood effectively to the lungs and the rest of the body. Due to the reduced blood flow and low blood pressure, individuals may experience lightheadedness or dizziness. This can manifest as a feeling of unsteadiness, a sensation of spinning, or even fainting. Now that you know all of the signs and symptoms of blood clots, let's discuss who are at risk. Blood clots can affect anyone at any age, but certain risk factors can increase risks such as hospitalization and major surgery, particularly involving the abdomen, pelvis, hips, or legs. Prolonged periods of sitting or immobility, whether due to a desk job, long flights, extended bed rests, or those confined to a bed or wheelchair. Severe trauma, such as a car accident, injury to a vein that may have been caused by a broken bone or severe muscle injury. Older age, if you are over 60 years old. Being overweight or obese. Pregnancy, which includes up to 3 months after the baby is born. Use of birth control methods that contain estrogen, such as the pill, patch, or ring, or hormone replacement therapy. Cancer and cancer treatments, family history of blood clots, smoking, long-term diseases such as heart and lung conditions, or diabetes. As we wrap up our discussion on the top 8 warning signs of blood clots, I hope you found this information both informative and empowering. If you found this information valuable, don't forget to give it a thumbs up and share it with someone who might benefit. Your health is a priority, and recognizing these signs can make a significant difference. Remember, ignoring the warning signs of a blood clot can have severe consequences. So if you experience any of these symptoms, it is crucial to seek immediate medical attention. Timely intervention can prevent complications and ensure the best possible outcome for your health. Always prioritize your well-being and consult with healthcare professionals for proper diagnosis and treatment. Until next time, take care and stay healthy.